so part of our discussions with individual patients and surgeons has been around using bioelectronics, particularly muscle stimulation for maintaining or even improving condition of the supportive muscles surrounding tissue, as well as the pain management side of it. Not having to scale the stronger painkillers because they can have side effects of the RonaCor. And it's a very interesting point, and I personally would absolutely agree that it's not given enough, I think, credence as it should do, given it plays such an important part in the patient's journey itself.
Anything we can do that's safe and non-invasive, that helps patients arrive for surgery in better shape is obviously worth looking at. We know that long-term use of anti-inflammatories such as Nurofen, diclofenac, all those things, ibuprofen, which is of course Nurofen, paracetamol, they can put your blood pressure up. They're associated with increased risk of cardiovascular disease, and that may just be because you're less active. So it's an association rather than causation, maybe. But if you can help patients reduce the therapeutic burden and risk of therapy by drugs, I think that's got to be something sensible we should all be looking at and evaluating in terms of how it affects our patients and hopefully improve their outcome from surgery and reduce the risk of complications. And eventually, you've seen this through Fortistat as well, the adoption of maybe wearable technology. So I can imagine you putting on a pair of smart tracksuit pants when you start your rehab, for your hip replacement. Every morning you put these things on. That feeds into the app and gives real-time data on loading, range of movement, and then you correlate that with the patient's perception of what they're feeling. And you suddenly got this enormous amount of information through which you can interpret, and then you put your intervention on top of that, say NuroKor or whatever thing you want to do, and perhaps start to see some real-time changes in patients' behavior and performance.
Not that far away, Jeremy.
No, it's not. It isn't. I quite agree.